are going to be learning a little bit more about Foundry BC, which is super exciting to have them back again. We did have them last year as well, provide a webinar for us. And we're so happy to have them back. My name is Jamie Morris. I am one of two mental health coordinators with FISA. You can see my picture there on the right. I also work in one of our independent schools in the ISABC at a school called Brockton School. And in that role, I am the director of student services, so overseeing learning resource supports, mental health, SEL, all of that from junior kindergarten to grade 12. And I'll explain in a moment what the role of mental health coordinator actually is, but I'll just pass it over to Michelle Hussey that she can introduce herself.
Good morning. It's nice to see everybody. It feels like it's a very dark morning here in the Okanagan where I'm calling in from. I'm with Jamie Morris, the mental health coordinator for FISA schools across BC. I also work for Class Open Learning, which is an online independent school. And I'm super excited to bring Foundry to you. If you're not familiar with it, you probably are. But what's great about this webinar, Jamie and I, when we met with the team, we already felt like we were pretty familiar with Foundry. But what we discovered is that we didn't have a full scope of what Foundry offers. And if you don't have a Foundry in your area and you have one coming, get excited because it is an amazing resource. My own son just turned 25 in November, and he was so sad because he just aged out of Foundry, and he was accessing services since he was about 16. So it really is accessible for our youth, and it is such an amazing resource for them to tap into, but for us as educators to also know what Foundry does. So we're really excited to have Julia and Sierra here today.
Yes. Before we jump into learning about all the things you may know and may not yet know about Foundry, I'll just let you know a little bit more about who Michelle and I are and why we're here hosting this. So as we mentioned, we are your mental health coordinators, and our role with FISA BC, first of all, is to support and advocate for independent schools across our province, of course. We do this primarily by, advocating and liaising between our schools and outside systems, including the Ministry of Education and Childcare, as well as Ministry of Children and Family Development, mental health units, and other many resources in the various communities around BC. We also, of course, many of you have been getting back and forth emails from us as we support you with the Middle Years Development Instrument implementation. And of course, we also host professional development. Last year, we were so fortunate to travel around the province and meet some of you in person as we provided Pro-D on mental health education in schools. We also sometimes go into schools and provide personalized Pro-D for schools. And of course, we host webinars like this one with Foundry. So I will be passing it over to our wonderful guests, Sierra Turner and Julia Hayos from Foundry BC. So briefly, I'll say, I know that Foundry is amazing, and I live in North Vancouver, the traditional unceded territories of the Squamish, Musqueam, and Tsleil-Waututh peoples. And we actually have a Foundry, brick and mortar Foundry near Lonsdale Quay, and it is amazing. If you ever have the opportunity to go visit a Foundry, I do suggest you do that so you can learn a little bit more about it. But they also offer virtual services, and the services are aimed for students aged 12 to 24. And it's all about health and wellness resources, services, and support. So I'm going to stop sharing and stop talking and pass it over to our wonderful guests.
Awesome. Thanks so much, Jamie. I'm going to get my screen shared here. Just a moment. Okay, Julia, can you confirm with me that you can see my screen?
Yep, I can.
Awesome.
Thank you.
Perfect. Great. So as Jamie and Michelle both mentioned, we're so grateful to be invited back. We received a lot of just really great connections after the last couple presentations. So really great to be able to have further conversations with many of you. And so hopefully this is not too much repeat information. I know we kind of added some more recent data into this presentation. And yeah, we'll open up time at the end for any questions or comments, concerns, all the things. So just before we get started, just want to take a moment to acknowledge with gratitude that I myself am joining from what's known as North Vancouver on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. But I'm aware that people are joining from all across BC today for this webinar. So feel free to pop in the chat where you're joining from, if that's something that feels comfortable for you. So I know Jamie gave some brief introductions. Again, my name is Sierra. I use she, her pronouns, and I'm the communications officer with Foundry, specifically supporting the virtual team. So kind of doing all the things like presentations and some website stuff and engagement with communities and just trying to learn how communities can learn more about Foundry and kind of spread that word. I will pass it over to Julia to introduce herself.
Good morning, everybody. Thank you again for joining us today and for having us out. My name is Julia. I use she, her pronouns. I'm joining you today from my home where I also work and play on the unceded and traditional lands of the Okanagan Syilx people in what's otherwise known as Kelowna. And I'm the operations lead with Foundry Virtual, so I support all of the staff that we have within the team, all of our program areas, our program development and growth, and basically anything and everything to do with how our program is landing in communities and how we grow and evolve as a program.
Perfect. So just as a brief kind of overview of what we'll be chatting about today, we'll talk about Foundry as a whole, where some of the centers are, just knowing that folks on this call are living across BC and working across BC. And then we'll kind of really dive into focusing on our virtual services. We'll talk about how to access our virtual services, some data around kind of what we're seeing and learning from some of our kind of toolbox platforms, some next steps around kind of how we can connect further if that feels right for you. And then we really want to open up the floor at the end for some conversations. So if you have any questions for us, we can use that time to connect. And we just have a few questions for you as well, just kind of what you're seeing, how we can possibly support, if that makes sense. So just to lay a bit of the framework of Foundry, so currently we have 16 open centers, as you can see here. The blue dots listed, we have 9 that are in development. And then we actually had, back in the spring, some funding from the government to open 10 more centers in the next number of years. So kind of between, I think it was September till early November, we were engaged in a process called expansion. Some of your communities may have applied. And yeah, it's really just kind of to essentially bring more centers to communities across BC. Those will be announced likely in the kind of early spring.
Okay, so it's been amazing to see the growth and evolution of Foundry, and clearly from that slide, the previous slide, just how many more centers are popping up across the province, which is amazing. And Foundry Virtual was developed as a service about 3 years ago. Just coincidentally, it was being planned right as COVID kind of came to fruition across the country, across the province. So we were able to really leverage COVID as an opportunity to get virtual off the ground quickly and on a broad scale. And what virtual is meant to do is essentially operate the same services, and we'll talk about those in greater depth in future slides, operate the same services as a young person would access in their community, but really try to use virtual to fill gaps in services across the province. So in communities where there are no brick and mortar centers, in communities where there are gaps in other services, and really try to use the service to also complement what's happening on the ground. So that might be through our offering of extended hours. That might be working with communities where maybe they're missing primary care, or maybe they're missing, counseling supports for youth kind of experiencing mild to moderate mental health challenges. So we're really trying to figure out, as we grow this service, how we can best play a supportive role in the existing system of care across British Columbia. Similar to centers, all our services are free and confidential. We are not a referral-based service, so young people can actually book their own appointments with our service providers. And we'll talk a little bit about that in the slides ahead. We currently offer, sorry, Sierra, I'm just looking, this is over to you.
No, that's okay, go ahead.
Okay. So similar to, for those of you familiar with Foundry Centers, we offer an integrated service model within Foundry Virtual. And so what that means is we offer mental health services like counseling and youth peer support. And those can be offered one-to-one or in groups and workshops. We offer substance use services. We have services for families, both family peer support and family counseling. And we also offer a number of different groups and workshops specifically for caregivers. We have a growing primary care program, which we'll talk a little bit more about when we get there. And we have employment and education services through a program called Foundry Works in Education. And we will talk about that in a little bit as well. But the idea virtually is very similar to the concept of a young person walking in to a center in their community, but they're walking into one place online or dropping into one place online where they can get sort of that holistic model of support across anything that might be going on for them.
So our hours of operation, we are a little bit unique with our virtual team. We are open 7 days a week, and our hours of operation are Monday through Friday from 10 a.m. until 9 p.m., and then Saturdays and Sundays from 10 a.m. until 6 p.m. So really all of kind of the way that we established hours, grew our days from, I think it was 5 days to then 7 days, was really through feedback from youth and caregivers. And we were hearing kind of over and over again that young people were looking for support more in the evenings outside of school hours. And so that's where we really kind of developed our hours from. We also currently at this time offer drop-in services. So those are the more kind of in the moment support, not crisis care, but just you want to talk to somebody, you're maybe having a hard day, got a poor mark on a test at school, maybe feeling left out, got in a fight with your parents at home. Those are all really great kind of reasons as to access our drop-in services. So currently we offer drop-in counseling and youth peer support Tuesdays through Thursdays between the hours of 2 p.m. until 6 p.m. So we'll talk a little bit more around the app and kind of how a young person downloads the app and accesses services, but essentially they just get in a virtual queue, and when their turn is ready, they will be able to access their appointment.
Okay, so when we think about the mix of services that we offer within Foundry Virtual, these are the service providers that are on the front line offering those services. So within our primary care program, we employ nurse practitioners and physicians. When I use those in plural, however, the actual number of staff that we have within primary care, specifically our nurse practitioners and our physicians, to serve the entire province is actually quite small. So we have the equivalent of one nurse practitioner and the equivalent of one session of physicians right now. So that would be like one afternoon per week of physician time. So it's quite limited. So to support our primary care program, we also have a nurse and we have a primary care social worker, and they help to ensure that the young people that are accessing primary care in particular are those that don't have access to primary care services in their communities. We also employ employment counselor and an occupational therapist to support with the work and education program. We employ registered clinical counselors and registered social workers to support with the counseling aspect in the groups. We employ youth and family peer support workers with lived experience that they bring to the table as they're supporting young people and families. We have a strong administrative team who also connects directly with young people and helps them troubleshoot, helps book appointments if needed. Because we're an entirely virtual program, we rely on our tech support to keep us up and running. So we have a dedicated team to that. And then we also have an intake coordinator. It's a little bit different within our program because we're not a referral-based program. So we don't have an intake coordinator doing what an intake coordinator might typically do in a referral-based service. But this person is really dedicated to be able to connect with folks in the community, service providers in the community that have questions about whether Foundry is right for them, about how to support their young person to access Foundry services, and to be able to support our team to understand what services are available in communities across BC as they're connecting young people back to their local communities. So that gives you a bit of a sense of who we have on our team. And this slide just shows you where our service providers are located. So when we were developing the program, it was really important to us, and COVID enabled this, which was a little bit of silver lining, to set up a team. Because this is a provincial service, we want our service providers to be reflective of the populations that we serve across the province. So we've been really fortunate to be able to hire people who live across the province because we operate entirely virtually. So that's allowed us to have a lot of local expertise and knowledge within our team to make sure that we're really best able to serve young people from all across the province.
There we go. Okay, so a little bit more about how young people and their caregivers can access services. So there's really two methods. One is downloading the Foundry BC app. So on any smartphone, youth and caregivers can download the app, register for an account. There's two ways. They can register for a young person's account or a caregiver account, and then kind of going forward, book appointments, or they can do this on a desktop computer. And so we like to highlight kind of both avenues, as we know that not all young people or caregivers have mobile devices. They may be limited into where and how they can access that mobile device. We've gotten really creative and also leaned on communities for them to share kind of their own learnings around using, let's say, a desktop computer in a guidance counselor's office or in the library or somewhere that's a safe space for a young person to take an appointment if for whatever reason, let's say, home isn't a comfortable environment for that young person. We offer 3 modalities for people to access appointments. So they can do video, audio, or chat options. So video being, kind of what we're doing here, where you can see one another's faces and chat. You can do a phone appointment or audio, so that young person can be out on a walk. They can be at school. They can really be anywhere, but maybe they just don't feel comfortable being on camera. And then kind of the lowest barrier option is a chat session. So that more kind of messaging type of service. So we'll start kind of going into our services in just a little bit more detail, so you have some more information around kind of what's offered and if you can think of people who you're supporting who might benefit from some of these services. So our counseling, we offer counseling for both young people and their caregivers. So it's more of that kind of single session, one-off sessions, or just more kind of short-term counseling. Youth, again, can access this through the drop-in services through Tuesdays through Thursdays, and they can also schedule sessions up to 3 days in advance. So maybe they know that they want support, but they just don't need it in that moment, and they want to book ahead. A lot of our counselors practice from a place of what we call SFBT, so short-term brief. Actually, Julie, is it short-term brief therapy, or that better?
Solution focused brief therapy. Yeah, you're
perfect. Thank you. So that's kind of the modality that they practice from. They're able to support with referrals and accessing local services whenever possible and whenever needed. And all of our clinicians on our team are registered clinical counselors and and they are master's trained. So youth peer support, not everybody knows really what youth peer support is. Essentially, they are individuals who have lived experience with various mental illness, mental health, and wellness challenges. All of our peer support workers have gone through a pretty robust training. So, training with safety planning, training with self-disclosure, all that sort of stuff, just to ensure that they feel comfortable supporting young people with kind of whatever's coming up for them. A lot of the work that youth peer support workers do is around goal setting, empathizing and validating, sharing that kind of, relatability and lived experience, sharing resources. Sometimes even it's just a connection touch point. It's really, the young person that they're connecting with is feeling really isolated and alone. And so it's really just kind of that connection place. Again, we offer more of that single session and ongoing peer support. One of the things that's unique about youth, I guess all of our services being virtual, is that if for whatever reason, if a young person is in a session with a youth peer support worker, and for whatever reason, the young person is feeling a little bit more distressed or in crisis, all of a sudden, we are able to virtually bring in another counselor on the team to support with that, which is pretty rewarding. So similarly to youth peer support, we also offer family services. So one being family peer support. Family peer support is essentially, again, similarly to youth peer support, caregivers can connect with other caregivers who have lived experience supporting their young person. We know that it's often a very challenging and isolating time when you are a caregiver and have your young person struggling. You don't know where to turn sometimes. There's a lot of resources, not enough resources. So really just kind of that touch point to connect and learn about what exists in their community, ways to support their young person, and also ways to support yourself. We know that taking care of yourself is really important as a caregiver. So with that, we offer kind of that one-to-one family peer support. We also offer some groups, and we offer some workshops. Julia, do you want to maybe share a little bit more around kind of the family counseling that we're starting?
Yep. So family members, sorry, I'm just making sure I'm unmuted. So family members can, so it could be parents, it could be grandparents, siblings, whatever caregiver looks like. They're able to access counseling services from one of our counselors. It's not specific to counseling for them as an individual, but counseling in the context of supporting their young person. So it has to be parents or caregivers with a young person aged 12 to 24. And that's really providing them with support, resources, tools, whatever is needed to help them engage with their young person and support their young person in this process. And then similarly, if this is probably happens less so within our service at this point, but not, that's probably just an area of growth for us. But there is, when it's deemed appropriate, an opportunity to engage in actual family counseling where a young person could access counseling with their caregiver and have support of a counselor with them together. And sometimes that could look like a counselor and perhaps a youth peer supporter or a family peer supporter that joins the session as well. It could look a little different for everybody, but that's available as well.
Thank you. Awesome. I also am mindful, I see the chat going. I'm unable to see exactly what's going in there, but I'm sure either Julia can respond to a couple, and when we're done, we'll engage in conversation. I also will throw some links in the chat at the end as well, just if you're kind of going, oh, I want to read more about that, or I want to see what groups, for example, are available. I'll throw all those links in the chat after. So groups, this list is just kind of a few of the groups that we've offered in the past that are coming down the pipeline or that are currently offered. All of our groups are open to any young person across BC, and then the more kind of caregiver specific ones are for any caregivers, so including centers. And so really we start to offer groups when we hear feedback from young people that they want a place to connect with others in a like-minded environment, or from our clinicians who are kind of seeing a certain kind of theme arising with their clients. So for example, Queer Cafe, that was one of our earliest groups that we started as a virtual team. It's on pause right now, but we are hoping to bring it back in the new year. But that was a really kind of well-attended group where any young person who identified as LGBTQ could come, they could play games, they could connect with other people, you know, again, low barrier, camera on, camera off, whatever they felt most comfortable doing. Sometimes we would bring in one of our nurse practitioners to talk about sexual health care. We'd bring in, you know, another peer who had lived experience identifying as queer, really just to provide different opportunities to, again, connect or possibly educate. Some other groups include the Brave in Your Body group. That's really about establishing positive body image, self-compassion. So for kind of more of that mild presentation of kind of disordered eating. We have some more kind of like workshops. So one being folks made medicine bags and dream catchers. I'm always blown away at the creative elements of some of these groups and workshops. So kind of when we have more of a craft-based group, what we'll often do is maybe kind of open it up to about 10 to 12 people, and then whoever registers will send out kits in the mail directly to them. And then people can join virtually and engage in the craft together. Sometimes we'll bring it for that one. For example, we had an elder come in and teach the group how to make medicine bags. And then the caregiver support group, that group, for example, is a bi-weekly group where caregivers can come together and connect with other caregivers. And again, just really under the premise of feeling less alone, hearing how to maybe support their young person, learning from others, that sort of thing. And then our EFFT workshops, those ones are pretty special. That is emotion-focused family therapy. So those occur, I want to say, about 4, maybe 5 times a year. We often have a bit of a wait list going, but we encourage people to just email and get on that wait list, because sometimes the wait list moves pretty quick. But it's really just a way to learn pretty remarkable skills as to how to connect with your young person, how to validate them when they're going through a mental health or mental illness challenge. We have some clinicians who are trained in EFFT and are able to administer this workshop to caregivers in the community.
Okay, so hopefully some of my responses in the chat have been helpful. We can, thanks for the really great questions. We can carry that into the Q&A as well if there's anything outstanding. Keep them coming. So kind of as an extension of what I was mentioning a little bit earlier, our primary care service include support from a nurse practitioner, from nurse practitioners, physicians, a nurse, a primary care social worker, and often our team are supporting young people with if they need diagnosis, if they need tests ordered, if they need medication. They often support with referrals to specialists, whether that be psychiatry or specialists related to gender affirming care. They support with things like sexual health, mental health support, lots of different issues that a young person might typically go to their doctor for. So there is a lot that our team can do virtually, and that's amazing. And there are things that our team can't do virtually or can't do virtually alone. And so our motto within primary care is, wherever possible, we're first and foremost encouraging the young person to try and seek primary care in person if they have it available. So if that's through family physician, if that's through local walk-in clinics, again, our primary care is extremely limited. So we're really trying to focus on filling gaps in service with this particular service stream. Where a youth doesn't have access to services locally, our team is still always trying to provide a shared care approach. So we don't attach patients to our nurse practitioners or our physicians. We provide what's called episodic care. So we support youth with what they're going through, but then the idea is always to transition them back into their local community. And oftentimes the care that our team might be providing might require some physical assessment or some physical tests. And so they'll need to identify somebody locally within the community that can provide that shared care approach. This is a growing, this service stream within Foundry Virtual is growing really quickly. And we're having to really figure out how to work best with community in supporting young people within a virtual primary care model, and having to really, probably can't emphasize this enough, having to really figure out how to best utilize these resources for young people who lack primary care in their communities, because we know there are a lot of people who do. So that's a little bit about where we're at with primary care. The next one, Foundry Work and Education. So this is a specific program that Foundry offers across all the Foundry centers and Foundry Virtual, and it's designed to meet young people who may have some challenges that affect their ability to seek a job, to get a job, or to go to school. And so we have, as I mentioned, we have employment counselor and an occupational therapist who provide support to those young people to develop their resume, to develop skills, to do interviews, to actually help them to find jobs in their community and connect to employers in their community, or help them to access training and education programs that might help them to get to where they need to be. So there's lots of goal setting. Young people enter, if the young person kind of is, if it's deemed that this program works for the young person, they generally will be supported for about a year if that's needed, to help them actually get set up with whatever the training program might be, or with getting them with a job, seeing them through starting the job, providing that support along the way. It's a really, really well supported program, and growing as well. And again, with this program, we support, like the rest of our service, we support all young people across the province, but we're also really trying to focus in on young people who might not have access to these services in their local communities. So this is a program that is also continuing to develop and evolve as we go. Here's some specific information. We can provide information about this after the presentation, so you don't have to write it down or memorize it or anything. And this is just a note. Again, I think I've said this a number of times through the presentation, but as a service, we are available to young people across BC, and we're not limiting that, maybe a little bit in primary care, but not in our service as a whole. However, we also know that communities that are perhaps more rural or remote lack access to service providers locally and services, and there are challenges there. So we're also working as a team to try and figure out how we can best utilize our resources in working together with local communities that may lack services, and where virtual might be something to explore within that community. Again, it's never our service wanting to come and take over, but we want to play a supportive role in communities where there's a need and where there's an interest and capacity to access virtual. And our approach in doing that is to really work collaboratively with communities to figure out what the needs are and figure out how best our service can support some of those needs. Just share a little bit of data to give you a sense of kind of what we see coming into our program, broadly speaking. Generally, we're serving on average about 500 young people a month across our service streams. You go to the next slide, Sierra. We're seeing the majority of services accessed for mental health, and kind of goes down from there when we see a pretty high number, and this is continuing to grow, of interest and demand for gender affirming care within our program and primary care services as a whole. But this just gives you a little bit of breakdown of what we're seeing come through our doors right now as a primary reason. We do skew a little bit higher in the age range that we serve. It is always our goal, and it's a really important reason for us to connect with educators like yourselves, in that we always want to make sure that we're supporting the younger end of our age continuum as well. Foundries serves everybody, and Foundry's door is open to everybody. However, Foundry's mandate as a service is really to support young people in experiencing more mild to moderate mental health challenges, so we can really focus on prevention and early intervention. That's really the goal of Foundry, although not necessarily what we're seeing come through our doors. So some work that we need to do as a service is figuring out how we can support the engagement of youth earlier in their mental health or other challenges that they're experiencing, and earlier in the age continuum. This just gives you a breakdown of what we see from a gender perspective. We definitely see non-binary folks coming through our doors, folks identifying within sort of 2S LGBTQ, partly because we are low barrier and we offer services that support these young people. Again, just give you a little bit of a breakdown around sexual orientation and what we're seeing come through our doors. We know that the top 4 places that young people hear about us are from family, friends, healthcare providers, and or school counselor, teachers. So I'm sure it's no surprise to the folks on this call, but you play a really big role in helping young people to identify resources and services available to them, and they continuously, this is from data from young people themselves, they continuously share that these are the top 4 resources for them in terms of finding out about trusted places to access support. And then we show this slide we did the last time. The number has remained consistent since this service was launched, that about 30% of young people who access our service would have otherwise not gotten support from anywhere. So we know that we know from other engagement surveys that we've done that Foundry Virtual not only plays a role in kind of breaking down barriers to youth accessing services virtually, but we know that young people, after accessing services virtually, then feel more comfortable accessing services in person in their community. So Foundry Virtual, we know, is playing a bit of a bridging role to help young people build comfort and confidence in accessing local services, whether that be at a Foundry center or from other service providers in their community. And then lastly, this just gives an example of, some of the reasons that we see young people coming to access Foundry Virtual. So it's not specific to mental health and substance use. It's really across the continuum of issues. And we just want young people to know that the Foundry is here to support young people for whatever life challenges they may be going through, and trying to figure out how to help them make their lives a little bit easier, or have these types of things not impact their day-to-day lives. So I think that that is the end of our talking, and hopefully we can turn it over. Oh, sorry, one more. Then we can turn it over to the group for some Q&A.
Yeah. So just kind of as a bit of a next steps takeaway, we really encourage you to download the app, gain confidence yourself in understanding what the app is, so that if you have a young person in mind, that you can support them to download the app. We have received a lot of feedback just from various folks that we've connected with in different communities, that really just made booking that first appointment is the hardest part. So if you can support that young person to do that, that would be amazing. We also are super open to feedback. So if you were kind of doing this with a young person and you come across a barrier or a learning feedback that's both constructive or successful, we would love to hear about it. Again, I'll pop some links in the chat shortly. If you would like to connect with us further, my email is here. I'll also pop it in the chat, and we can arrange a meeting with myself and Julia, or other folks on the team who would make sense to bring in. And if you would like some posters or anything else kind of like that, again, send us an email and we can explore that. So as we just kind of open it up here, yes, I see some hands up, and I will stop sharing my screen just so that we can kind of have more of a conversation together. But we just threw some prompts in here just for our kind of own learnings. Again, it's, what are common struggles your youth are facing? Do you have any young people in your care that are accessing our services or center services? Any ideas around how we can kind of reach youth more? What are barriers, and how, really most importantly, can we best support you? So I will stop sharing my screen and open up the conversation.
That's good. There's a couple of questions in the chat, and then I see somebody had their hand raised. So maybe I'll just go to the chat first. So just going back up, there was a question from Nicola. What is the biggest obstacle Foundry faces? Is it lack of funding for more employees, or is it lack of people trained? So I can speak to Foundry Virtual, and I can give some examples of challenges that I've heard others face, but I can't really speak to Foundry as a whole. But I'll give some examples from Virtual's perspective. So from our perspective, one of the challenges that we face as a provincial program being available to everybody is how do we make sure that our service is best being utilized by those young people who do not have access to services elsewhere? And if we're serving young people who have services locally, how do we ensure that we're working collaboratively if the young person wants us to? And ensuring some continuity of care between services. So it's a big scope to be serving the whole province versus a specific community and having partners within a specific community. So we're always endeavoring to understand what services are available to young people locally, support continuity of care locally. But again, it's a tall order for our team to be able to do that. And that's an ongoing learning for us as a team. So I would say that's maybe one of the challenges that we face. And again, I think I've mentioned it a number of times. Examples within our primary care and what we're facing right now around challenges is trying to figure out how to ensure that our service is best being utilized by those who don't have access to primary care, and how we figure out as a service how to best deliver quality primary care in a shared care model, understanding that there are best practices and limitations around what can be done virtually. And so trying to figure out how we kind of work within that framework. I know that, some Foundry centers there, and this is an issue across the province, where there are a lack of service providers in specific service streams. And so for some Foundry centers, it can be a challenge to hire and to be able to provide that integrated service delivery model when, for example, there may be a lack of, counselors, or there may be a lack of physicians or nurse practitioners in specific communities. So trying to figure out how to bring in those resources can be a challenge for some communities, and some more than others, depending on the location of the center. Hopefully that answers a little bit of the question.
Can I just add, I was thinking more specifically, thank you for answering. This has been a great presentation. You're offering so much information. I'm learning so much, but I'm wondering in terms of the group, right? Like I'm thinking about in terms of what you said about the Queer Cafe and, running it sometimes and not, because I'm thinking, it's interesting. I work in a community where people are well resourced financially, but there might be some barriers, whether culturally or not, in terms of how much freedom kids have to go out on their own. So they're not able to drop into clinics. They're not actually able, even though I live in a city center, right? So I'm thinking like a Queer Cafe would be so amazing for kids whose parents don't know much about them, but also the ones who don't have freedom to hop on a bus or go out with their 100%. Friends at all.
Yeah, 100%. So Queer Cafe in particular that's been a really strong group and a really important group. We definitely, in terms of breaking down some of those barriers to access, the pause that we've had in Queer Cafe has just been a challenge for us around having some gaps in our youth peer support service, and really needing to have somebody with lived experience to be able to facilitate that group. So we're in the process of hiring and hoping that we're able to find somebody locally, and then hoping to partner with Foundry centers around the delivery of that. So I hope we can get it back up and running ASAP. We consistently hear that that's a group that's really needed. And so we're doing our best to get that back up and running. Sorry, I should have asked the context of the question before. Thank you for that.
No, that's okay. Thank you. It explains a lot. And, thanks so much.
So another question I see here, what about digital addiction? This is a growing problem in schools. Do you mean, is that an issue that we support young people with, or is there any concern around young people kind of also being online to access services?
I mean, it's a bit of a double-edged sword, right? And we were saying that they're digitally addicted, and yet, the only way to reach you guys is through the same means in which they're addicted, but ways to help them and ways to overcome. It could be social media, it could be multiple platforms, but this is such a problem. So.
Yeah, I think it's a really good consideration, a really good point. One of the things that we talk about within our service is kind of positive or productive uses of technology and those that may not be as productive. So something like accessing a group like Queer Cafe or accessing a counselor or accessing primary care would be a really productive use of technology. We know for youth that face barriers to accessing services or face barriers to connecting socially, especially young people living in more isolated or remote communities who may experience marginalization. Having a virtual platform to create social connection is really important. And again, I think this also speaks to the Foundry Virtual serving as a bridging role. What we see and hear from youth is that connecting with virtual first has helped them to reduce their own kind of barriers to accessing services locally. So I think that bridging role is really important. But I agree, there's, we definitely know that this is a problem across the board in terms of young people or everybody spending too much time on screens. So it's really about, I think, trying to focus on what's a productive use of the technology and what's not, because it's here. Hopefully that helps a little bit there. Sierra, yes, could you? Awesome, thanks, Sierra. I'm just looking through the chat. The challenges that you face are most anxiety, depression, and anger management. Thank you for sharing that, Cadence. Thanks, Tara, for some of these.
I see one, Julia, that says, can you support youth who have comorbidity of mental health diagnoses, particularly autism?
So yes, we can, and we wouldn't do that specifically within the context, or only do that within the context of our services. Our team would also seek out support from other services across the province that may be out there to support young people with autism or other neurodiversity challenges. But it is an area and a stream within our program that's growing. There's more training for our staff across our service streams around how to support neurodiversity. So it's a growing area, but we can provide some support, perhaps not specific assessments and things like that, but there is some areas of support within our service that we can provide. Sorry, I'm just looking through any other questions. The gender affirming care, thanks, Tara. So I didn't answer that yet. So what we can provide for gender affirming care can kind of go along the continuum. So it could be a young person coming that just wants to explore their gender and has questions, isn't sure. And so in that case, it may be speaking with a youth peer supporter, it may be speaking with a counselor to help them with that exploration. If it's somebody that has, gone through that exploration and would like to take their care journey a little bit further, our team or other Foundry centers, other services locally can support with a hormone readiness assessment and go into some really in-depth assessments about supporting that youth with understanding, what they're ready for, what they're interested in terms of transition and what that looks like. And if after that and collecting a lot of other collateral information is available, then the nurse practitioners or physicians can support with further exploration, for example, medication, hormone replacement therapy, exploring surgery options, things like that. I will say our gender affirming care across the province, the demand for the service is growing really quickly. We're seeing this in our program as well. And what we've seen within our program and what I want to make sure we sort of debunk in these presentations is that there's been sort of rumors that young people can get access to gender affirming care faster coming through virtual. That's not the case. We are really within this, we could otherwise just be a gender affirming care clinic and do nothing else within primary care. And we're not a specialty clinic. So we're really, if young people are coming in with this need, we're really first and foremost supporting them to access these services locally if they're available. And if they're not, then we're sort of supporting the young person to move through our stream. We have about a 6-month wait list right now for gender affirming care, and are working on building out resources to bring that down. But again, the demand is continuing to increase. Our focus for gender affirming care right now is over 18. Primarily virtually due to just needing them to be over age of majority to help with making decisions around that type of care. So that's kind of the direction that we're headed right now within the virtual service. Thanks for all the really great questions. Appreciate it. Any other questions? And could be, you feel free to just jump in, raise your hand. Okay, well, thank you again for joining us this morning to listen to what we have to offer and for all the really great questions. As I think Sierra mentioned, we're really keen to connect with communities. If there's an interest in figuring out how to, promote Foundry Virtual among young people, and or if others want to hear more about our services, we're really keen to connect. So please always feel free to reach out if any questions come up or anything comes up. We're here.
Thank you so much. That was really thorough. And again, I learned some more information there. Someone did message me privately just asking if the slides will be shared. I don't know if that's possible. We could put it, if you're comfortable with that, we could put it on the FISA website for people to access, or send it out to our attendees. But this recording will be on the FISA website as well, where people can fast forward or pause or whatever if you want to go back and look at the slides. And Julia, I believe earlier in the chat, you mentioned Kelty Mental Health. And we are actually we are going to be hosting another webinar similar to this on Monday with BC Children's and their teams. I'll put the information in the chat. And in that conversation, we're going to be talking about Kelty Mental Health, the school promotion team, and Compass. And I know when I was talking to the BC Children's team, they mentioned, oh, do you want us to talk a bit about Foundry? I'm like, well, Foundry is actually coming. So beautiful to see these connections and learn about all these different services in the ways that we're trying to support our youth across the province. So thank you, Sierra and Julia, for coming and sharing all of your wisdom and all the things about Foundry and for your time. I think this was really valuable, and I can't thank you enough. Thank you.
Thank you for having us, and thanks for spending your Tuesday morning with us.
Take care, everybody. Thank you. Goodbye.
Bye.
Take care. Bye.